Professor Dr. Yaqub Qazi. So, sir, welcome as part of the panelists. And now, the man of the hour. I will not keep myself between you and him. When you Google, today there's a era of technology, and when you Google Dr. Mubir Hassan Rathore, straight away a few things come up in the search engine. This is number one, that is, he's the head of the infectious diseases in his hometown from Florida. And number two, all the experienced ones and all the experienced teachers in our lives are usually not that well versed with technology and all that stuff. But Professor Mubin, when you search him, there are so many podcasts on infectious diseases that you can come up and listen to. Yesterday I was listening to a few of them, and the challenge that he is going to address today is viral illnesses, specifically pertaining to herpes, and how to treat them effectively. So, without further ado, sir, please come on stage and grace us with your talk.
Assalamu alaikum. It's a pleasure and an honor to be here, so I'm here actually more to learn from all of you, and I'll try to introduce together. The way I practice I know that is very different. When Children's Hospital of Islamabad was inaugurated, I was asked to get a very famous pediatrician who was in charge of that. He used to have a center in Lahore. Remind me, Dr. Mushtaq Khan. His son Daniel is a pediatric cardiologist in UK. So Dr. Mushtaq was in charge of Children's Hospital, and late Dr. Mumtaz was a young budding assistant professor. So Ali, don't ever underestimate that time. It was the first time I really realized how little I know about medicine and pediatrics. I had been in the States at that time I took my exam and I went to the United States and didn't have the privilege of working in Pakistan, and that's when I realized I was a misfit, and I had a lot to learn. And over the next almost 30 years, I've been trying to learn from all of you, and every time I come to Pakistan, I learn a lot. You should all be very proud, and I'm very proud that some of the best clinicians are actually in Pakistan. We don't have technology. I am on patients, and when they tell me that MRI of the head is now part of history and physical, I chuckle. It's so easy to do. We just, in our NICU, we just have now started we have point of care ultrasound. We have point of care echo machines in the NICU. So we do in not just in Pakistan, but in many lower and middle income countries, we become excellent clinicians. So I was going to tell you some stories about Dr. Iftikhar, who was my external when he took my exam, and I was examining the spleen. Dr. Ahmed Ali, who was North Medical, my professor, he had taught me a lot. But I'm going to leave there. So what I'll do today is I will, and I move around. So if you can't hear me in the back, please wave. So that way, herpes. And I mentioned about my time at Children's Hospital, and there was a baby with neonatal herpes. And that was the first time I realized what a misfit I was. Available intermittently at that time, but it was extremely expensive. And so I could never, because as I said, I never practiced in Pakistan. I could not even imagine that I will write an order for acyclovir to deal with realities of practicing. So today we are going to focus on acyclovir and herpes virus infection. The red are the ones for which acyclovir is going to be effective, and we know. Now, there are, reality is that it does not work against them. Acyclovir, before we had ganciclovir and ganciclovir, our oncology colleagues used to use acyclovir as a prophylaxis for EBV and CV. No, SV and VZV, herpes simplex virus and varicella zoster virus, against which acyclovir is. So, there are lots of drugs that are anti-HSV. You have, or Dr. Sajid Makbul may remember, because when I started my training, acyclovir had just been approved for neonatal herpes. Before that, it was vidarabine, or I think it was called Era-A. And it was a terrible drug, but it was the only thing available, but it had lots of side effects. So when acyclovir came along, it took over, and nobody used vidarabine since then. Of course, now we have valacyclovir. So acyclovir is both IV and oral, and there's also topical. Valacyclovir is a prodrug, and it has a much better absorption than acyclovir. So it converts into acyclovir at and during absorption. Then you have penciclovir, famciclovir, neither of which is approved for children. You have foscarnet for CMV infection, which still has a role, especially in resistant CMV infection. And ganciclovir is the sort of the basic medical antiviral, anti-CMV medication. If any one of you is going to be at the symposium starting on the 14th, I'll be talking about CMV management. And then ganciclovir is also a prodrug, and it's oral drug. Obviously, I'm not going to be talking about those today. It's many of you are probably pediatricians and general practitioners, and even if you are internist, prevention is always better. And for herpes, we really have a prevention for varicella zoster, not a real prevention for HSV, herpes simplex virus. And VZIG, which is varicella zoster immune globulin, is a drug that we used frequently after chickenpox exposure in children. That drug is no more available. Now we have VeriZig, which is a Canadian product, and it's now available in the United States. Some people have used IVIG, intravenous immune globulin, but it's really not very effective, because VZIG and VeriZig are actually hyperimmune globulins, so they're specific against that. And of course, now we have the vaccine for zoster, Shingrix, and we have we have the chickenpox vaccine. I don't know why I didn't put it on there, but the chickenpox vaccine is really done wonders for prevention of chickenpox and all its complications. Many of us who grew up, I remember myself getting chickenpox, and I remember our neighbor's daughter had chickenpox, and my parents sent my sister and I to their house so we get chickenpox. Because parents knew, everybody knew that chickenpox, if you get it as an adolescent or an adult, it has a lot more complications. But I can tell you, chickenpox in kids, younger kids, also has some very severe complications, and I've seen them. In fact, one of the first papers I tried to write, it never got published, was a hemorrhagic varicella infection in a 6-year-old. And I had a great respect for that. So let's talk about HSV. And HSV can cause lots of different diseases. The infection can. Obviously, we all know about oral and genital which is the mucocutaneous herpes. In the oral herpes, gingivitis is can be very severe. Personal experience, when I was just a brand new faculty member at University of Florida, I had I think she was 5 years old, a 5-year-old girl who had severe oral gingivitis. And she was she could not take anything by mouth, so we had to put her in the hospital, give her IV, and she improved, and we are about to discharge her, and then I got a call before my rounds from my resident saying that she's seizing. And to make a very long story short, this girl ended up having CNS herpes infection and was deaf and blind before she was discharged. I've never seen anything like that, and it was shocking to me that a 5-year-old comes in with gingivostomatitis, treated appropriately, getting better, and suddenly had this downturn. Probably had the infection sort of starting even before that, but and the day of discharge she started seizing. So don't